नमस्कार दोस्तों। वेलकम टू यूपीएससी डॉक्टर। जैसा कि आपको पता है, ये हमारे चैनल का लिंक है और ये हमारे चैनल का लोगो है। ये हमारे चैनल का नाम है। मैं पहले भी इसके बारे में बात कर चुका हूँ। सफलता रातों रात नहीं मिलती, लंबे समय तक निरंतर प्रयास और धैर्य ही तुम्हें तुम्हारे लक्ष्य तक पहुंचाता है। ठीक है। कंसिस्टेंसी ऑफ एफर्ट ओवर द लॉन्ग रन इज एवरीथिंग। देखिए, अगर आप कंसिस्टेंट रहेंगे तो एक ना एक दिन आपको सफलता जरूर मिलेगी। चलिए आगे बढ़ते हैं। हमने लॉन्च करी थी सीरीज फॉर जनरल प्रैक्टिशनर्स 1% बेटर एवरी डे। आपको पता है, लास्ट डे हमने नीडल स्टिक इंजरी एंड पोस्ट एक्सपोजर प्रोफाइलैक्सिस देखा था। अगर आपने ये वीडियो नहीं देखा है तो ये वीडियो आप जाके देख सकते हैं हमारे चैनल पे। चलिए, ये सब हमने देख लिया था। आज का जो हमारा टॉपिक है दैट इज जनरल फिजिकल एग्जामिनेशन। देखिए, कोई भी डॉक्टर है या फिर अभी जो ग्रेजुएट हो रहे हैं, सबको ये बेसिक आता है। ठीक है, फिर भी कई जगह कंफ्यूजन रहती है। ठीक है, तो आज हम उन कंफ्यूजन को दूर करेंगे और वो एक होलिस्टिक तरीके से जनरल फिजिकल एग्जामिनेशन देखेंगे। चलिए, पहला स्टेप क्या रहता है। देखिए, कभी भी आप पेशेंट के पास जाते हैं बेड से, तो फर्स्ट स्टेप लाइक जो होना चाहिए, इट्स इंट्रोड्यूस योरसेल्फ, देन सीक परमिशन फॉर एग्जामिनेशन, then ask the patient whether he or she is comfortable or not. After doing all this, first step is to take vitals, whether your assistants can also take or you. Pulse, BP, respiratory rate, temperature. These are the vitals. If you found any abnormality in the vitals, first correct those vitals. Okay. Now comes to the general examination. Step 2 is general appearance. We know. First of all, when we look at the patient, how he or she appears. How will you describe the appearance of patient? First of all, we need to describe the apparent state of health. Whether the patient is looking ill, acute or chronically ill, or frail, or she is looking fine. Okay. Then we need to check the level of consciousness. In order to check the level of consciousness in bedside, we have a scale AVPU scale. If the patient is awake, alert, responding to verbal stimulation, if patient is responding to painful stimulation, if patient is completely unresponsive. On that scale, you can check the level of consciousness of a patient. Or else, we can check the orientation to time, place, and person just by asking some simple question like अभी क्या हो रहा है, दिन हो रही है या रात हो रही है, अभी आप कहाँ पर हैं, आपके साथ जो खड़े हैं वो कौन है. These are the simple questions which can be used to check the alertness and awakeness of the patient. Is there any signs of distress, like any cardiac distress or any respiratory distress? This patient is in pain. Like, how will you be able to check whether it's like any respiratory distress is there? There will be flaring of nasal ale, sternocleidomastoid टॉट हो जाती है इन केस ऑफ रेस्पिरेटरी एफर्ट जब इंक्रीज होता है. ठीक है जी. इंक्रीज्ड वर्क ऑफ ब्रीदिंग. So these are the some signs of respiratory distress. Then you check skin color, and if there is obvious lesions, then how the patient is dressed, grooming and personal hygiene. Facial expressions are very important. Odors of the body and breath, like maybe there is some toxication, posture, gait of the patient and motor activity of the patient. These all you need to generally check in whether in the patient. चलिए आगे बढ़ते हैं. First of all, you will look the face. After looking at the face, there are multiple clues. Like in case of acromegaly, the face appears to be, the chin and jaw appears to be prominent. There will be large hands. If you know, in acromegaly, there will be like pituitary. lesions which lead to increased growth hormone production, which further increased insulin like growth factor 1, which lead to the overgrowth of bone, organs, and tissues. Treatment is control growth hormones and IGF-1, and ultimate treatment is surgery in case there is any pituitary adenoma. फर्दर मैं आपको बताना चाहूंगा कि अगर इंक्रीज ग्रोथ हार्मोन चाइल्ड्स में होता है जब फ्यूजन ऑफ ग्रोथ प्लेट नहीं हुआ है, इट लीड्स टू गाइगेंटिज्म। चलिए आगे बढ़ते हैं। देन कुशिंग फेस, मून फेस, यू नो, एवरीवन नोज, रेड चिक्स, राउंड मून फेस। कुशिंग क्यों होता है? देखिए कुशिंग में क्या रहता है, देयर मे बी सम पिट्यूटरी डिसऑर्डर which lead to the increased adrenocorticotropic hormone which एड्रेनलिन पे एक्ट करके इंक्रीज कोर्टिसोल। देन एड्रेनल डिसऑर्डर हो सकता है which leads to increased cortisol, और मे बी आउटसाइड स्टीरॉइड्स like strong steroids like prednisone, सोलोन। अगर इसको यूज करा गया है लंबे समय तक, इट मे लीड टू कुशिंग सिंड्रोम, बफेलो हम्प, thin arms and legs, easy skin bruising, stretch marks on the body. Okay, then comes to the like down faces. Trisomy 21 leads to Down syndrome. Flat nasal bridge, short neck, small ears, slanted eyes. These are the features of the down face. Then Marfanoid. Marfanoid is a condition in which there is FBN1 gene mutation. This FBN1 gene codes for fibrillin 1 protein. This fibrillin 1 protein is a major component of microfibrils, which helps in structural support and elasticity to various tissues. These decreased fibrillin level leads to connective tissue disorders. So in Marfan syndrome, what will we see? Elongated head, long and tall legs. There will be some cardiac diseases like aortic aneurysms. Okay, vertebral deformity will be there. चलिए आगे बढ़ते हैं. Myxedematous face. Myxedematous face, how will it appear? There you will see periorbital edema, dull skin, puffy face with dry skin, sparse, dry, coarse hair. Okay. Severe hypothyroidism leads to myxedema. When will you examine a case? There will be decreased breathing, temperature will be low, BP will be low, saturation will be low, and there is non-pitting edema. This non-pitting edema in myxedema caused due to the accumulation of mucopolysaccharides in the skin. I will talk about it later when I जब हम एडिमा पढ़ेंगे तब मैं आपको बताऊंगा। मिक्सिडेमा जो कंडीशन होती है, इसमें जो ट्रीटमेंट होते हैं, हम आईवी लीवोथायरोक्सिन देते हैं 100 to 500 माइक्रोग्राम। देन मेंटेनेंस टिल शिफ्ट ऑन ओरल, वी यूज स्टीरॉइड्स, एंटीबायोटिक्स एंड सपोर्टिव केयर। चलिए आगे बढ़ते हैं। थायरोटॉक्सिक फेसिस, हाउ विल दे अपीयर? एक्सोप्थेल्मस, exophthalmos, eyes appear upper sclera visible, upper sclera visible. These are hypothyroid cases. Okay, anti-thyroid medications we give. चलिए पार्किंसोनियन केसेस देखो, पार्किंसोनियन केसेस को हाइपोमिमीमिया भी कहते हैं। In this type of, there is reduced ability to express emotions through face, like patient don't smile, don't raise their eyebrows. Okay, hypomimia. चलिए after looking the face, you will see eyes. Eyes में you can see, check the pallor like this. This is normal. Here you can see pallor. It states hemoglobin level is low. Then you can check for icterus in upper sclera. Basically, upper sclera में check होता है. This is icterus due to increased bilirubin. चलिए, you can check Bitot spot, vitamin A deficiency, corneal dryness will be there. In hands, you can check for cyanosis. Cyanosis can be central, can be peripheral. Cyanosis occurs when there is less than 5% of deoxygenated, more than 5% of the deoxygenated hemoglobin in the blood. Look at these hands. This is peripheral cyanosis. In hands, you can also check for clubbing. Clubbing pathophysiology is like this. Hypoxia will be there. Hypoxia leads to increased vascular endothelial growth factor and platelet-derived growth factor. This further increases capillary density, which leads to clubbing, platelet accumulation and all. Causes of clubbing, like this is the mnemonic clubbing, cyanotic heart disease, cystic fibrosis, lung cancer, lung abscess, ulcerative colitis, bronchiectasis, benign mesothelioma, infective endocarditis, idiopathic pulmonary fibrosis, neurogenic tumors, gastrointestinal disease. There are multiple causes of clubbing. Okay, चलिए आगे बढ़ते हैं. Now, after checking clubbing, we'll look for lymphadenopathy. Look at this swelling in the neck. This is lymph node swelling. It can be localized or generalized. Generalized lymphadenopathy seen in tuberculosis and leukemia, whereas localized lymph node swellings seen in infections, metastasis, and Hodgkin's lymphoma. If the consistency of this lymph node is hard, it may suggest you carcinoma. If it is soft, it is normal. If it is rubbery, maybe lymphoma. If it is tender, it states acute inflammation. If it is fixed to underlying structures, it is not moving, then it may be malignant. If overlying skin is inflamed, there may be infection. Chali. In oral cavity, we can look for ulcers like aphthous ulcer. Look at this ulcer. Chali. Then edema. Edema is accumulation of fluid in interstitial space. Edema can be bilateral and unilateral. Bilateral edema causes cardiac, renal, hepatic, nutritional. Unilateral lymphatic filariasis, traumatic or metabolic. There is grading of edema. 1 plus both feet present, 2 plus both feet plus legs plus arms, 3 plus is generalized body swelling, which is also known as anasarca. चलिए अब I want all of you to stay focused there. Mechanism of edema formation. This is very important. Look at this. This is vein, this is artery, this is capillary. Okay. This space is interstitial space. This is lymphatic drainage system. Okay, connected to the vein. Chaliye. There must be some hydrostatic pressure because of the blood, and proteins are present inside the blood, which leads to the oncotic pressure. ये फ्लूइड को अंदर खींचेगा, ये फ्लूइड को बाहर ले जाएगा. दिस इज नॉर्मल मैकेनिज्म. What happened if hydrostatic pressure increased? ज्यादा फ्लूइड आ जाएगा, एक्यूमुलेट हो जाएगा. ठीक है. इसमें कुछ कुछ प्रोटीन्स भी आते हैं, लेकिन ये प्रोटीन्स जो होते हैं ये लिम्फेटिक सिस्टम के साथ चले जाते हैं. तो इस तरीके की स्वेलिंग जो होगी ना, इधर कहाँ पे फ्लूइड है, तो दिस विल बी पिटिंग, एडिमा विल बी देयर. अब मान के चलो ऑनकोटिक प्रेशर जो है वो कम हो जाए, उसके भी बहुत सारे कारण होते हैं, मैं आगे बताऊंगा. लाइक प्रोटीन कम हो गए, तो again there will be fluid accumulation but no protein accumulation because lymphatic system is working well. Again pitting edema. If this lymphatic obstruction will be there, then the proteins which are coming over the time accumulates there and binds with the fluid, which leads to the non-pitting edema. Non-pitting edema comes to this. See this obstruction of lymphatic flow, lymphedema. It's lead to non-pitting edema because of accumulation of proteins over the time. Okay. like seen in filariasis or any malignant obstruction. If capillary permeability is increased, like in case of infection, there will be edema. Decreased osmotic pressure because of loss of proteins, like seen in nephrotic syndrome. Decreased production of proteins, like seen in liver disease, it leads to the pitting edema. Okay, concept is clear. So this is the mechanism of edema formation. What we need to remember is hydrostatic pressure. If it is increased, it leads to edema. Oncotic pressure, if it is decreased, it leads to edema. If there will be obstruction in lymphatic drainage, it will lead to pitting edema. Otherwise, in two cases, non-pitting edema will be there. So, this is how we concluded our general physical examination. First of all, like again, general appearance, introduction and all, general appearance, then vitals. After vitals, we will look for pickle, basically, है ना? पहला icterus, cyanosis, clubbing, lymphadenopathy, edema. इन छह के छेद के बारे में मैंने आपको बता दिया. This is mnemonic basically. You can remember by pickle. Pallor, icterus, cyanosis, clubbing, lymphadenopathy, edema. Okay. साथ में you will see face, you will see mouth. That's how you will conclude your general physical examination. Okay. You will like comment on this thing. Look at this. General appearance. You will comment on general appearance of an individual and alertness and awakeness of the individual. Okay. So that's how we completed our topic 2 general physical examination. Stay tuned. गाइज जो भी देख रहे हैं ना प्लीज ज्वाइन कीजिए सब्सक्राइब कीजिए एंड कमेंट कीजिए यार है ना और शेयर भी कीजिए अपने दोस्तों के साथ ओके बाय टेक केयर हैव अ नाइस डे